Hello, everyone, and welcome. We are so excited for you to join us today for our UltraClear webinar with Crystal Coast Cosmetic Care. If you have any interest in laser treatments or in rejuvenation, we're going to explain what this laser is all about, what it can be used for, why you might consider it over other treatments, and why we're so excited for this new device. While you're getting situated, I'll tell you that not only do we have a great presentation, we also have some time for a Q&A session with our speakers after, so make sure to stick around. And obviously, if you have any questions during the presentation, please feel free to put them in the little Q&A box right at the bottom of the screen. And if you have any questions or technical difficulties, you can use the chat feature and I'll be here to support you. We also do have an exciting promotion tonight, so make sure to stay tuned until the end of the webinar, and I'll explain how that works and how you can claim the promotion. And before we get started, let me introduce you to our wonderful speakers. Dr. Roska is a board-certified otolaryngologist with over 20 years of service in the U.S. Navy, bringing extensive experience to the Jacksonville and Crystal Coast communities. He specializes in nasal and sinus surgery, thyroid and parathyroid procedures, and cosmetic services with a strong focus on patient-centered, minimally invasive care. Lizzie Rice is a certified aesthetic nurse with a strong foundation in critical care and emergency medicine. A Daisy Award recipient, she is known for her expertise in lip filler augmentations and her commitment to enhancing natural beauty while prioritizing patient safety and comfort. And finally, Kristen Woodruff is an experienced aesthetic nurse injector with over a decade of clinical practice in NICU and pediatric critical care. She combines her extensive medical background with advanced training in Botox and dermal fillers to deliver natural, confidence-boosting results through personalized care. And without further ado, Dr. Roska, please take it away.
All right. Thank you, Rob. Good evening to everyone. Enjoying the comfort of your own homes to spend a little bit of time with us here this evening. So we are very excited to be able to present this literally cutting edge technology for the UltraClear laser, literally the world's first cold fiber laser, and we'll get into more of that. But until then, I'm going to turn things over here to Lizzie Rice.
Hi guys. So I manage the Surf City location, and it's a little satellite location off of Cape Carteret's location. And we are going to be having the 3D Miracle there coming soon in 2026, mainly for 3D Miracle. So stay tuned and learn more about that now.
All right, we're going to go ahead and start our presentation here this evening. And the first is a video reel.
The first of its kind, cold ablative fiber laser solution. The first device to give new life to all skin types. Finally, a way to treat every single patient. UltraClear, the first safe solution for sensitive skin, especially skin of color. Optimized to individual needs, balancing cold and thermal energy at the optimal wavelength. Ablative resurfacing and 3D collagen remodeling in one pass, delivering each pulse to the exact depth with precise timing, minimizing risk and pain, allowing faster healing with optimal results, keeping patients safe from discomfort and side effects, something they can count on every time, no matter what. Letting them get back to their day quickly and making sure they feel amazing when they leave. Be the first and move your practice forward. UltraClear, the clear choice to reverse the signs of aging for all skin types.
Wonderful.
So this is a truly a wonderful topic to talk about because this truly is, as I shared earlier, the world's first real advance in laser skincare. So we're essentially moving on, if you will, from the realm of the CO2 lasers, which is just an incredible statement to even make. within the world of laser care. So when it comes to being a candidate for the UltraClear, it's really a matter of addressing the many concerns that people have had over the years to include at present, where people are looking for improved skin tone, texture, addressing wrinkles from fine, medium to even advanced. People with pigmentation concerns, whether it's age-related or sunspots or a combination of both. And then certainly, and we'll talk about this in more detail with Lizzie, even sharing some personal treatment, um, and that is in the realm of acne and surgical scars. So we are very interested and focused too as a practice to be able to reach out into the community where people with difficulty with acne scars can sometimes feel marginalized within the community as far as uncertain as to what is really available for them. So um, there was once the CO2 laser that I used to have to provide these types of acne surgical and scar care treatments, but really the UltraClear has just become center stage with taking care of our acne community. So and I'll just, put that out now too, that even if you're not one who deals with acne scars, if you know anyone, friends or family, please refer them to our practice because we'd love to be able to have the opportunity to take care of them. And then ultimately, through all of this, we're looking for overall skin rejuvenation, really thickening up that dermis, building healthy collagen and elastin, and addressing all of these kind of candidate type concerns. So why would one choose the UltraClear laser over some of the other lasers that have traditionally been available, with one of those workhorses being the fractionated CO2 laser? Bottom line is that no matter how the CO2 laser is managed, no matter how amazing the laser physics are or the engineering of that laser, you can only do so much with it. You can only kind of slice and dice it in so many different ways. You can only fire it so fast. And so, with that being said, it's limited. And so, every day it's limited with what it can actually do. So, when we compare that to the UltraClear, or vice versa, the UltraClear is just head and shoulders above any fractionated CO2 treatment that is currently available, which is an incredible statement again to make in the world of laser care. So this is the world's first cold fiber laser, and we'll move on from this slide. And so we'll park here a little bit to talk about skin types. This UltraClear laser is um, kind of, in a sense, skin type naive in the fact that it can treat all skin types, which is again another incredible statement to make within the world of lasers and laser skincare. And so one of the ways in which it does this is that cold fiber laser technology. So it puts um, such a small amount of energy in comparison to what a CO2 laser is. So your amount of collateral damage is significantly less. And so the UltraClear is putting in the right amount of energy with every pulse to accomplish the end goal for skin rejuvenation without compromising skin of color. And so the concerns that darker skin patients have had with previous laser technology is just not present with the UltraClear. And so it really, for the first time on a global stage, opens the door to all skin types. And this is just your layers of skin and soft tissue and muscle. So we'll move on from this because we're going to discuss this in much greater detail as far as the treatments for 3D Miracle, and then Clear, and then UltraClear, and then finally Ultra, and deepest treatments being laser coring. So this is where we'll actually spend more of our time to really break this down so it's more understandable and more digestible. So when we look at the superficial 3D Miracle treatment, and this is really one of the workhorse treatments for the UltraClear at a superficial level. So this is working in that most upper level of the epidermis, the stratum corneum, and it allows a tremendous exfoliation of the skin with skin cell turnover. So you have that beautiful, natural go and glow look about your skin. Um, and so there, and I don't need to read this slide to those of you that are tuning in with us. And then as we work our way deeper to the moderate, which is going to be the clear, UltraClear, there is just increased treatment options as you work your way essentially deeper into the skin, and you can start to reach down and treat some of your pigment, wrinkles, acne scarring or surgical scars or traumatic scars. And then last, with your most advanced being the ultra and the laser coring. Laser coring being that vaporization of tissue to allow for actual contraction and tightening of tissue. And we'll see before and after sections with each of these different treatment levels, and we'll talk in more detail. And both Lizzie and Kristen will be able to share their own personal experiences. So we're going to move over next and talk about this downtime section here. This is another revolutionary aspect of the UltraClear laser. So with your more traditional laser treatments, again, being fractionated CO2, because of the tremendous amount of heat energy that's entering into the tissues, there's a lot of collateral damage. And I can speak to this firsthand as well from the fractionated CO2 laser that I used to own and do treatments with. And basically sold last year as I gained the UltraClear laser. So with the fractionated CO2, your recovery time would be out to 8 to 10 days and beyond, with increased inflammation, still quite red in appearance, still sloughing skin from the treatment. And so again, this revolutionary cold fiber laser minimizes that, even for your most advanced treatments with the laser coring, down to about 5 to 7 days of being red and sloughing of tissues. And we have many of our own examples, before and after pictures, as well as sequential time sequence photos of people going through treatments and then recovering through that first week. So, and I'll make one last comment on this slide, and that being the 3D miracle. And again, Kristen and Lizzie will both highlight this. So it's really true. It is minimal social downtime. And I'll pause because I don't want to steal what they're going to share a little bit later in the program. So we'll move on to our next slide here. This is just a little bit of a timeline of laser technology that's getting developed. And then you see a Claro come on the stage. And I think it's also interesting to share that Dr. Shlomo, who is one of the founders for Claro as a company, so people can rest assured that he is truly one of the giants, one of the leaders in the laser aesthetic industry. And he has, again, revolutionized the aesthetic arena of laser skincare with the development of this Claro's company, UltraClear laser technology. This is going to be a demonstration of how the UltraClear with the 3D IntelliPulse technology is actually treating within the tissues.
And just because it heat cools, it decreases that thermal damage, which actually helps improve the healing time and expedite it a little bit faster. You can see it's hot, cold, so it gives the tissues time to relax and give it a break. So you're not as hot as you would be if it was a true fully abrasive laser.
Yeah. No, that's well said. And when we're watching kind of an animation of laser coring channels or laser penetration into tissues. It's really just that. The energy is staying well within those channels and not extending out to the surrounding tissue, creating even more damage, inflammation, and prolonged healing.
I think the best part about how deep that goes is the amount of collagen that you're going to build from how deep you're going, because collagen is built in that dermal layer. So exactly that layer where that second and third, yep, exactly there is where you're going to get the most collagen production, which is why laser coring is super important for those that have lax skin that want to make it a little bit more robust and have the tissue a little bit tighter.
Yeah, absolutely. So this next slide will be more of a real look at the laser in action.
You get that one there.
And this clinician, Dr. Friedman, is one of our international figures in the realm of cosmetic dermatology and aesthetics.
And that one's a 3D miracle, right?
Mm-hmm.
That's being done.
Yeah, that's very near.
So
Yeah.
that one's just that top superficial layer that's similar to a chemical peel, but a lot accelerated recovery time. So you're not waiting a whole week to heal out. It's minimal downtime with this one.
Yeah. And I think as we watch this, another important point is that Lizzie had mentioned chemical peels. So chemical peels, can certainly be wonderful and give wonderful results. Once you start to get into your medium depth chemical peels, you do experience rather robust peeling, of the overlying skin as you're exfoliating. Whereas with this 3D Miracle treatment, you're a little bit pink, red. Lizzie and Kristen will share their firsthand experiences with you. But it's very, very minimal, flaking of exfoliated skin versus what you would see with a chemical peel.
It's not like a typical laser where you need these big laser shields on your eyes, just a normal eye protection, like seeing there. The patient's pretty comfortable. They're talking, they're laughing through the whole procedure. Like it pretty much just feels like a sunburn.
Yeah, for
That's
sure.
about it. Just that superficial layer, as you can see, a little pink, little red, but very minimal.
Okay, so now we'll enter into the portion of the presentation that will start moving from superficial to deepest to the laser coring. So here in this first section with the 3D Miracle, I'm going to turn things over to both Lizzie and Kristen.
So this is the 3D Miracle that we're going to be hosting at Surf City on Thursdays. This is a great introductory to lasers if you've never used one. Lasers can be intimidating. This is something you can do. It takes about 15 minutes. You don't need to be topically numb for. It really is addressing that superficial layer of skin that's really great for texture, fine lines, pigment, things like that. Very superficial stuff. If you have deeper scars, that'll be the next chapter here. But if you have any of those basic concerns, it's a very superficial treatment. I've had it myself. I've had the 3D Miracle and I've had a chemical peel, and the healing time for the 3D Miracle was a lot more manageable, itching wise, and that kind of stuff. Even with the post treatment with the VI peels, it's a little bit more manageable to get through the 3D Miracle. What I will say is the heat that you feel from the 3D Miracle initially is a little more than you would feel from the VI peel because you're numb with that phenol peel. But the overall healing time, a week down for the VI versus, I mean, she had one yesterday.
Yeah.
She looks gorgeous. So there's really no doubt.
Yeah, I had one yesterday and really minimal, like it was just like a sunburn. I did skincare last night, and then today I'm wearing makeup again this afternoon. I did do about 24 hours without makeup. Your skin will be a little burny to like putting on any makeup or skincare, so just be careful with what you apply. But overall, like it feels like a sunburn pretty much for like a couple hours.
Yeah. And you can see with these, so for this patient here on the neck, it's mainly pigment that they're lifting. But you can even see some of those more superficial fine lines and wrinkles did efface some, which we want to go through and maybe do some coring on her, something a little bit deeper to get those deeper red-its, maybe. But for a 3D miracle, that's a really great, impressive result for one treatment 5 weeks apart. That's huge.
Yeah, and they're like a series of three is what we would aim for with 3D Miracle too. You definitely want to try to do a series with that too every 6 weeks.
Right. And as Kristen shared, so the treatment series of three seems to be, almost kind of a cliche within aesthetics, but within the world of aesthetics, with the design of energy-based equipment, even with some of the chemical peels, it's that they're done in stages. So there's treatment to affect the tissues, then allow for the whatever area of the body that you're treating to be able to heal up over 4 to 6 weeks, and then to follow back up with your second, then ultimately your third treatment to gain your maximal results. And so that's really gained and established through clinical trials that are done, research and development with either chemical peels or the energy-based technology.
I love that this laser is skin inclusive. So coming from a big city, I'm from Massachusetts, Boston, that whole area. It's every single color. Down south. It's a little less common, maybe by the military town, Jacksonville, a little more diverse. But this is one of the only lasers that you can use on any skin type, which is huge. This is why we use the VI peel. We like to be more skin inclusive at our practice. So this is huge. You can use it on Asians and any fits all the way up to 6, especially with this 3D miracle. I think the next slide is a darker Fitzpatrick. And you can see that you're getting a lot of PIH lifting. So people that have post-inflammatory hyperpigmentation from acne scarring, texture just from needing a good resurfacing peel. You can see up by her hairline, there's some extra skin buildup that just need to be, slothed off. That's all superficial. That can be done with a 3D miracle in about 15 minutes with no numbing. That's one treatment, or is that post third treatment? So it took her 3 treatments to lift up that pigment, but for a fits of probably 5 or 6, that's amazing for a laser to be doing that and not hypo or hyper pigment her. That's impressive.
Right. Yeah, absolutely. And this is also the UltraClear fits so well into our practice because we do have a passion of being able to treat all comers within our communities, and to be able to reach out to, again, people that darker skin tones where they can feel a little bit marginalized within areas because there's not always technology that is safe for them to receive for skin and tissue rejuvenation. So we have, I'm going to go back to the previous. So for an Asian patient, which is a Fitzpatrick type 4. So we have a couple of Asian clients that we have treated with the UltraClear for pigment. Also important to note, Asian clients, especially women, can have a horis nevus, which is a little bit deeper pigment. Again, that this laser is able to lift. And then we have one of our clients, very similar skin tones, Fitzpatrick type 5, and she came in for UltraClear treatment because of she has some difficulty with acne still into her adult life and has had some post-inflammatory hyperpigmentation, similar to what you see here with this lady. And she's been through one UltraClear treatment and she's been pleased with her results, and she'll be coming back to see us more this winter for more laser care. So here's an example of another skin of color. So Asian client, again, with that really dark, heavy horis nevus type appearance around her eye. And so the laser produces dramatic results. And she's 2 treatments through her treatment series of 3. So again, another skin of color patient, again, with addressing pigment.
I have a lot of patients that complain about their melasma, and this is a perfect laser for those who have difficulty with melasma. That 3D Miracle puts off so little heat that it really shouldn't irritate or harm or create melasma. Um, and they actually have a melasma protocol for the UltraClear laser. So it's because it's a cold fiber laser, you're able to
Pre-treat.
you're actually able to pre-treat, and you're also able to um, get some change in the skin and lift pigment without causing further damage on those melanocytes if you have a history of melasma.
Yeah, well said. And I'm going to pause here on this photo with treatment of the back of the hand. So some of the telltale signs of aging are going to be changes around one's eyes, neck, around the mouth, and back of the hands. So, and this also demonstrates too that this laser is highly versatile. You can literally treat from head to toe. And so we've done treatments of scar care on um, older gentlemen's legs, the traditional knee replacement scar, as well as large surgical scars. The other treatments that we've done that, again, you just don't hear much about because there's limitations on technology to manage them, and that's treating stretch marks. And so we've, gotten good results, not only with patients that have come in, but also with staff. So at this point, we're going to move deeper into the layers of skin that we're going to be treating. And so again, this is one of those telltale signs of aging around the eyes, periorbital rejuvenation. So this is, yeah, this would again be the go-to laser, again, in comparison to the fractionated CO2 treatments that I've done over the years, where they're good, but you're wanting better. And so this UltraClear delivers those better results. And I'm going to turn things back over to Lizzie again.
I actually feel like I did a combo of the Ultra and the laser coring, which both are great for scar removal. I had a breast augmentation last year, I think it was, and it was around the time that we were getting the Ultra Clear. When I found out that they did scar removal, I was like, we need to try this. So we went ahead and did my surgical scars, and they are gone. They look very similar to the one on the far right. And yeah, we're not even, I think, not even a year out of our surgery. So, I mean, it's an amazing treatment for people that have C-section scars, mommy makeover scars, knee replacement scars, keloided tissue, that kind of stuff. We can do the UltraClear or the laser coring, depending on how deep of a scar it is. Mine were a little bit more superficial because of where it was on the body, but being able to use the UltraClear on and off the body is, or on and off the face is huge. To be able to use it on the body is huge. There's so many lax areas that people complain about that is really hard to treat. So above the knee, you get some extra scrunchy tissue, a perfect reason to use the UltraClear. Behind the arms, some of them in the front of the arms where there's this extra lax tissue. That's another way to kind of get more collagen build in those areas that are easily lax with age.
Yeah, absolutely. Lizzie mentioned keloid scars. And so certain ethnicities are prone more to keloid scar tissue formation. So the other beautiful aspect about this UltraClear laser is you can use it as a laser knife. And so we've done just that with a Afro-American Fitzpatrick type 5 skin, and did a laser keloid assisted or laser assisted keloid removal from his left earlobe, and then created basically a tissue flap to be able to cover that area where the keloid was removed. And then just this past Saturday, used the UltraClear as a laser knife for scar revision on a young lady's forearm where she had had a difficult scarring with grease pigmentation in her tissues. And so the laser did an amazing job. Again, the take home is that you're minimizing the amount of energy that's going into the tissues. And then for a procedure where you would normally have to do additional cautery to control bleeding, the laser provides all of that for you with minimal energy input.
And you could just do one treatment because it looks like all of these before and afters for the UltraClear are to show you how amazing it is after one treatment. But if you've seen befores and afters from a 1 to 3 series, it's incredible. So the results from a post one treatment is amazing. You can see on the scar, it's lightened, but it's not gone. The more treatments you do, obviously, the better the results.
Mhm.
But even if you get massive change after one treatment, it's a lot more financially beneficial for everyone if they see massive changes on one treatment. It makes you want to come back for more and encourages you to get more. I know after my scar removal, I'm like, I guess I can get more surgery now. No one needs to know about it. I can get them removed really quickly, and I wasn't even numb. It's very quick. It's very quick, and that thermal energy is regulated through the tissues, so it's very minimal and easy.
Again, seeing another periorbital rejuvenation. Again, I'll just stress that um, this laser can literally avoid potentially the need for expensive blepharoplasty surgery or periorbital surgical rejuvenation at the lower cost of laser eye rejuvenation.
Those lower blephs are hard to get covered with insurance. The upper is a little more reasonable because they get in your way and it can be covered with insurance, but the lower blephs are a lot more difficult to get insurance to cover. So you're looking at $4,000 to $7,000 depending on the surgeon when these treatments are one treatment, maybe a week downtime, and non-surgical.
Right. Absolutely. I like this before and after. Again, you're seeing this theme of these one treatment with the UltraClear. So this is a lady who's and this speaks to the versatility of this laser as we work up through the tissue layer. So there's been some laser coring for her acne scarring, as well as UltraClear. And then as you get more superficial with the UltraClear, the clear to lift pigment. And so that's an incredible result for just one treatment.
Yeah.
The neck
Yeah.
is tough to treat.
Yep. You want to talk about neck?
It's tough. I hate talking about necks. There's not a lot of options for the neck, or there's multiple options. It's like all the options are none options, and this is a perfect in between where you don't need surgery to have a good improvement. With platysma band Botox, I bet you this would be killer.
Yeah. Tighten it. It tightens a lot, and then
Yeah.
the Botox too. Yeah.
Yeah, and you can see it's worked on that lax skin. I'm not going to say it makes it tighter, but the collagen stimulation does make the tissues thicker, which makes it harder to fold in. So you can see there's just less of that scrunching going on lower just because the laxity of the skin is less.
Right. Agree. And we'll see as we get to the laser coring, the results when you start to combine modalities. So we'll move again. So this is just demonstrating the UltraClear being blind to skin of color and being able to produce consistently great results with extremely safe treatment margins. So we do take care of kiddos as well. And these treatments can be done in the office without the need of going to the operating room. So this is another substantial change where in the world of pediatric care for laser treatments, you oftentimes end up in a sedation suite or the operating room to do that sort of laser care. So again, with the cold fiber, reduced amount of heat energy that you're putting into the tissues, these treatments can be done in office. And for the kids that we treat in the practice, whether it's for procedural, surgical, or even aesthetic type care, they do well, and we have a great team to take care of kids, especially now with the latest edition of Kristen coming out of the world of NICU and PICU care.
Yeah, I love my babies.
So that's a good like melasma-like patient.
Yeah. So we'll park here a little bit. There's a number of different aspects to talk about in this 3/4 view for this lady. Again, a lady with kind of a Fitzpatrick type 3/4. And so there's improvement that you can see along her jawline as well as along her neck. And again, you're looking at just one treatment. And so with the and we should probably mention at this point, so with the UltraClear laser, they technically, as a company, cannot talk about lifting, the laser providing lifting, but the bottom line is when you're treating tissues and you're getting improvement, thickening of the dermis, and some contracture that's occurring as the skin heals and rejuvenates, you do get some lifting of the tissues, and that's clearly demonstrated here along her jawline, and we see that in her neck as well. And again, take home again, this is just one treatment that she's had.
Right.
Yeah, I need some CO2, so I can do that sometimes.
Yeah, so, and again, this is a very dramatic change. 3 treatments for this lady, but again, you have a number of different aspects that you're treating as you treat layers of the skin. So this will be now toward the end of the talk as we address the deepest layer of treatment with the laser coring. And so this is truly a vaporization of the tissue layers.
And it's not just burning a hole straight down, it's going like a corkscrew. So it's, as you can see, it's spiraling through. So they're redistributing 360 the heat as it goes in, as it's being put down, and then it's giving coagulation time and rest time in the tissue as it's coming down. And as you see the healing, it's not that it's tightening the tissues, but they are growing and fusing together, which does make tissues tighter.
So I'm just going to look through the next.
I don't know if I'm allowed to talk about competitors, am I?
Yeah,
But
go ahead.
But Ellacor is one of those brands that came out as a coring device where they would actually go in and cookie cut the skin and then pull out tissue. So then similar idea to this, where then the tissues would grow together, leaving healthy tissue, bad tissue, healthy tissue, and it should in turn make the tissues very tight and increase collagen. This is Ellacor, but without the how do you say it? Like there's coagulation going into the tissues at the same time. So there is clotting and healing and it's less messy.
Yeah, it's literally little.
I don't know how to explain it. Like
Yeah.
it's less messy, it's less damaging, it doesn't scare the patient as much when they're walking off, but they're getting a very similar result. It's just given delivery by a laser instead of a mechanical cutting device, which obviously would be very painful. This is pretty manageable pain wise. I had laser coring without any numbing on my surgical scars. Do I recommend topical BLT? Yes, I will recommend that. But do you need it? If the scar is this big, maybe not. because it really does coagulate as it goes through. There was no pinpoint bleeding with any coring device where you're going 2 millimeters deep to get to that mid dermis where you're actually growing collagen. You're gonna get bleeding, and the fact that they're not walking
But it's
away
not
looking
like
crazy
not
is
like blood
wild.
everywhere. It's just little pinpoint bleeding.
Pinpoint,
Yeah.
pinpoint, which Ellacor, I'm not saying they're a bad company. It works similarly. It's just patient experience is everything, and I think the patients tolerate how they leave the office a little bit better than they would if it was the other device.
Yeah.
That's for sure.
Right. Yeah. Well said. The again, in this photo that we're looking at here is a before and after, and then when we go to the next one to again highlight the neck, and I'm going to return back to this previous one so you're able to see a little bit more. So again, when you're treating up through layers, we start with our deepest layers first when we're doing the coring. So we lay down our coring first, and when you're doing laser coring in the neck, we think of it in the terms of like a surgical neck lift, in that we're going all the way back behind the ear and down the hairline. That way we get a maximal contraction of tissues and thickening up of the dermis. And then these are the type of results that you can see. Again, you're just one treatment. And so a number of different aspects to talk about, with starting with the laser coring first and then moving up into the dermis with the Ultra and the UltraClear. And then also she's having lifting of pigment all throughout her face. And looks like they probably could have done some more UltraClear for her neck to lift pigment as well. And then Lizzie, do you want to comment
Oh, you're gonna ask me about the
additionally on the neck?
neck?
Yeah, what I was just going to share. So Kristen and I took care of an older lady who's a long-standing RN in our communities, and this is the a similar type appearance of her neck, and treated it in a very similar manner with aggressive laser coring up through her jawline and then down to her clavicles and all the way back to her hairline. And so we just saw her back the other day, this past week. She's about 2 to 3 weeks out from her laser coring and healing up nicely and waiting for all of those amazing tissue texture changes to occur. And on that note, when you're doing more aggressive treatments, it really does take about 3 months of healing for the body to lay down all that new healthy collagen and elastin, allowing tightening of tissues to really start to see your long-term result.
Yeah, she's doing great with it. She's not in any pain or anything. She said it went really good with her healing.
And then we'll pause here just a little bit on this. So again, the area around the mouth can be one of those telltale signs of aging with the smoker's lines or straw lines. And this is the type of laser with advanced treatments, and again, working up through tissue layers, that you can start to get the eraser out on wrinkles, which is dramatic and amazing.
Unfortunately, Botox can't do that. No
What's
lips
that?
can do that, unfortunately.
Again, this is just a highlight, rejuvenation around the eyes. And these are results too that do not even include blepharoplasty work. So this laser coring, the UltraClear treatments for eye rejuvenation, can be done in combination with either upper or lower or both blepharoplasty. And at that, I am going to turn the program back over to Rob.
Thank you all so much. So we have some pretty exciting promotions today, and I'll give you, so for 3D Miracle, we are offering a $99 initial 3D Miracle treatment and then for the other two sessions of your package of three, those will be $299 each. And then for the Ultra Clear, everybody will receive 50% off of their treatment. So these are some pretty huge discounts here. And I will put how to claim them in the chat feature right now. And essentially, you'll just text our main line tonight, and we will get back to you tomorrow morning. So make sure you claim those promotions because they truly are amazing. And then I'm going to turn it over to a Q&A session. So if you have any questions, now's your chance to ask them in the Q&A box within the Zoom. We've already got one. How many sessions do you recommend if you are going to treat surgical scars?
So for surgical scars, it depends on where they're at because it does make a difference treating from facial scars, which the face heals like no other area of the body. And as we move from head to toe, as you get lower on the body to the area around the hips and stomach for stretch marks, and then onto the thighs for stretch marks. And then as we treated one of our staff members who had the surgical knee replacement scar, as well as a very large melanoma excision scar on the back of his calf. Those are going to take a much longer time to heal when you look at the blood flow dynamics and just ability of tissue to heal and recover. And so circling back around to, the question that was specifically asked. So therefore, it takes into account where it's located on the body. And then if the scar is raised and hypertrophic, or if it's even thickened like a keloid scar, if it is an older scar, or if it is a newer scar. So we take all of that into account. And so essentially, it sounds cliche, but no one scar is equal to another. And so we we do our consult counseling, begin with that first scar treatment. And before we even do that, there'll be a scar care plan set in place that also goes over, importantly, pricing.
Awesome. All right. The next question is there a consultation fee?
So we do our consults at no charge.
Awesome. All right. Okay. Our next one is and we kind of talked about this already, but I'll ask it again. Why would I choose this over a CO2 laser, for example?
Oh, is this one of the reps that's online with us in the webinar? So no, I moved on from my fractionated CO2 laser for a variety of reasons. And I can tell you from the many years that I owned the CO2 laser and the treatments that I did over the years, whether it was for wrinkles or tissue texture changes or for pore size or for acne scarring, that I don't want to I'm not going to completely badmouth CO2 laser, but it's becoming an older technology, and it was an amazing technology over the years because it's what we had, it's what the industry had, it's what we had to be able to take care of patients, whether it was for medical functional reasons, burn scar care and all those things, or aesthetics. But it honestly just leaves you wanting. So because we want the very best of outcomes for every single person that we have the privilege of taking care of. And with the CO2, I was just left wanting for my clients to have better outcomes. So with that said, once I heard about the UltraClear and the opportunity to move on to that laser, I decided to move on from my fractionated CO2 laser. And I'll make this statement as well because it's what is being talked about, and that is with the UltraClear laser technology with that 2910 cold fiber, that it's going to be I mean, this is a huge statement, but it's essentially going to be replacing fractionated CO2 laser technology.
Awesome. Okay, so our next question is about aftercare. How long do I need to stay out of the sun after I get treatment?
Yeah, great question. We're going to break this up. I'm going to turn some of this over to Lizzie and Kristen. So again, once again, it does depend on how deep your treatment is, because you're going to have anywhere from the 3D Miracle through the deepest of laser coring and then everything in between. So I'll let Kristen and Lizzie start.
For the 3D Miracle, about you need to wear sunscreen no matter what treatment you get. But 2 weeks, I would say, stay out of the sun after your treatment for the 3D Miracle, and wear sunscreen after like 48 hours, and try to cover your face before you go out in the sun, like with a hat or whatever. You just don't want to burn the open pores. So sometimes sunscreen can irritate it. So just be cautious right after the treatment.
Obviously, it gets more. I mean, I'm not saying for laser coring that you have to be out of the sun forever, but
Yeah.
obviously, the deeper the wound, the more that we want to protect that new growing skin. So, if 3D Miracle, that's like a 2 weeks is well, for me, but probably for laser coring, I would imagine it'd be a little longer than that, if not to avoid altogether. Which is probably why it's a best treatment for wintertime
Yeah,
right
for
now, where you
sure.
can just kind of avoid being out, laying out, sun
Getting it
exposure.
now.
It's
Yeah.
one thing to see the sun, it's another thing to be laying and basking in the sun. That's laser coring is probably not the idea for August,
No.
but maybe September, October.
Yeah. So there, Rob, I was just going to say real quick. So there is like a laser treatment season. And so, looking, it's almost kind of a Labor Day to Memorial Day for laser season. And
Mhm.
then, especially by us, by the coast, as you roll in, between Memorial Day and Labor Day, is the sun intensity really picks up. And it's really not, except for those diehard clients that just don't go out in the sun. They choose to protect their skin at all cost. So there are some people that can do those deeper laser treatments in the summer, but that's not the rule.
Definitely. All right. Another great question here. You mentioned pigmentation, but will this have any effect on facial capillaries?
Good question. So
Doc?
yeah, sure, I'll take that one. So yes, it does, and so again, in that spectrum, like with the CO2, um, and so now with the UltraClear, with even lower energy footprint, that as you're treating through layers of the skin and as you're getting down deep enough in the layers to address blood vessels, so you do. And so that's going to be some of that pinpoint bleeding that you see with the deeper treatments. And so um, when you look at, and I'm just thinking back to the presentation for the UltraCooler back at the beginning of the slide deck, that one of the indications that it really did not mention was for prominence of blood vessels or telangiectasias. Um, However, when you're doing those deeper treatments, you're naturally going to coagulate, cauterize those fine blood vessels that you see. Uh, and some of those more noteworthy areas is going to be in this mid-face area around the nose, and as we age, or people that deal with rosacea. So yes.
Awesome. All right, we have time for just a couple more questions here. So if you get any kind of numbing in the upper levels, is there like a delay on when you need a ride? If you need a ride, I think I worded that how they did. Do they need a ride home if they get any kind of numbing
Yeah.
from the upper levels?
Yeah. Good question. So, um, one of the things that, we pride ourselves in is, patient-centered care and patient comfort, no matter what procedure people are getting done. And so we take that seriously. The topical numbing that we use is compounded at a compounding pharmacy that we've used over the years. And so it's highly effective no matter what procedure that we're using it for. And then one of the things that's important, and you don't always see this in whether it's in-office procedures, surgeries, or aesthetic care, is allowing the numbing medicines to set up long enough to really allow that patient experience. And so we take that into account. Sometimes that can honestly be a little bit longer portion of the overall treatment is making sure that people are getting numb enough and comfortable. But that's also super important to do. And really with these UltraClear treatments, you don't need to go to the level. So here there was a question a little bit ago about CO2 laser in comparison to the UltraClear. So when I was doing fractionated CO2 laser appointments and getting really aggressive with them, I would have to do nerve blocks I'd have to block the whole center of the face, V1, V2, V3. I'd have to do tumescent numbing out in the lateral face, in addition to leaving the topical numbing on for 30, 40 minutes. And then on top of that, we would even use in-office Pronox. It's kind of like laughing gas, but we would have to put all those parameters in place just to get through these more aggressive fractionated CO2 laser treatments. And I'll share this in the spring when we are doing our first day of models. We're focusing on all the laser settings and taking care of each of our clients and having a lot of good discussion. And I just stopped midway through the day and I looked at the rep and I said, I can't believe how much I'm doing with this UltraClear laser with only topical numbing on. So that's another revolutionary part of this UltraClear laser.
Awesome. All right, time for just one more question. Will you give me a list for aftercare products that I can get, or do you have any specific recommendations?
Yes. Lizzie, Kristen, you guys want to talk about that some?
I think you have the aftercare kits for PCA,
Yeah.
right? That you're giving them with the
Where's
laser
that?
balm, or is it
Yeah.
LTMG?
We do. So again, as far as our skincare and aftercare for post energy based post laser, it's we really have done the research to put the very best products in the hands of our clients. And so we do just that. So Lizzie, mentioned that already. So we have post-care kits. The kits are rolled into the pricing for the laser treatments. And then our aftercare guide is literally walking each client day by day through what they need, what to expect. And everything is all laid out. If there is anything that needs to be purchased, we make sure we address that in the consult so that people can have that all set up at home for when they arrive back after post laser.
Those are for like the big procedures. That's for like laser coring and the
True.
ultra
Yep,
field.
for sure.
The 3D Miracle, it really is like wash your face and
Yeah.
moisturize at the 24-hour mark and SPF, and it's really just a superficial treatment. So
You could do like a vinegar with water soak or something if it's burnt to alleviate some of the burning, but
Right.
Awesome. Well, that is all the time we have. Remember, everybody, to text the number in the chat to claim your promotion, and we'll get you on the schedule. We should reach out to you no later than tomorrow morning. Lizzie, Kristen, and Dr. Roska, thank you so much for this presentation, and thank you, everybody, for joining.
All right. Thank you all so much. Good evening.
Thanks.